When managing diabetes, most people focus on cutting carbs, taking medications, and tracking blood sugar. But there's a critical piece of the puzzle many overlook: minerals. These essential nutrients play a vital role in insulin function, nerve health, and protecting against serious complications. Unfortunately, diabetics are often deficient in key minerals, which can make managing the disease much harder. In this video, we'll explore the top 3 minerals every diabetic needs: magnesium, zinc, and chromium, and how to get enough through food and supplements. 1. Magnesium. Magnesium is one of the most overlooked minerals, yet it's crucial for stabilizing blood sugar and keeping insulin working properly. High blood sugar levels cause the kidneys to flush out not only glucose but also magnesium. Over time, this creates a vicious cycle. Low magnesium increases insulin resistance, which keeps blood sugar high, leading to even more magnesium loss. So the signs of magnesium deficiency can be pretty subtle at first. You might notice muscle cramps, maybe fatigue, or even tingling or burning sensations in your feet. Sometimes it shows up as irregular heartbeats, anxiety, or just plain trouble sleeping. If this goes on for a long time, deficiency can actually damage your nerves, impair fertility, increase your risk of kidney stones, and, even raise the likelihood of diabetic retinopathy, heart disease, and strokes. Thankfully, magnesium-rich foods can help break this cycle. Some excellent sources include pumpkin seeds. Just 1 ounce gives you about 40% of your daily needs. Spinach is great too. 1 cup cooked offers around 38%. Almonds come in at about 27% per ounce, and dark chocolate, well, that's roughly 24% per ounce. Even avocado gives you 15% per fruit. For folks who enjoy gourmet meals, dishes like miso-glazed salmon with sesame spinach or almond-crusted fish with Swiss chard can deliver over half your daily magnesium needs. If diet alone isn't enough, supplements can help. It's best to look for magnesium glycinate or bisglycinate since they're easy to absorb and gentle on your digestion. You'll want to avoid magnesium oxide though, because it's poorly absorbed and can upset your stomach. Also, just be mindful of habits that drain magnesium, like eating too much sugar, drinking alcohol or caffeine, consuming processed grains, and taking excessive calcium supplements. 2. Zinc. Zinc is another mineral that diabetics lose more quickly due to increased urination and chronic inflammation. Zinc is vital for insulin production and function, as well as wound healing, immune health, and nerve protection. Deficiency symptoms include slow healing cuts, frequent infections, sugar cravings, skin problems, hair thinning, and reduced fertility. In men, low zinc can lower testosterone and sperm quality, while in women it can disrupt menstrual cycles and hormone balance. You can boost zinc through foods like oysters. Just 3 provide over 200% of daily needs. Beef liver gives you about 80% per 100 grams. Pumpkin seeds offer about 50% per ounce. Grass-fed beef has roughly 40% per serving, and chickpeas provide about 25% per cup cooked. Gourmet options? Well, those include oyster sashimi beef tartare or lamb chops crusted with pumpkin seeds. For supplements, choose zinc picolinate or bisglycinate, around 15 to 30 milligrams a day. Over the long term, it's important to balance zinc with copper intake to avoid imbalances. Also, watch out for high-sugar diets, phytates in unsoaked grains, excess calcium, alcohol, and junk food. Because honestly, all of these can drain your zinc. 3. Chromium. Chromium helps insulin move sugar from the bloodstream into your cells. Like magnesium and zinc, it's lost more quickly in folks with diabetes, especially when blood sugar is high, stress levels are up, or your diet's heavy in processed carbs. Low chromium honestly can make blood sugar a lot harder to control. It can increase sugar cravings, cause fatigue and mood swings, and even contribute to nerve damage, kidney stress, and fertility issues. Now, if you're wondering where to get more chromium, here are some top foods. Broccoli. Just half a cup gives you about half of what you need for the day. Grape juice, if you have it in moderation, is about 40% per cup. Brazil nuts are pretty amazing. 1 nut gets you about 30%. Lean beef gives you around a quarter per serving, and eggs offer about 10 to 15% per egg. And hey, if you want a more refined meal, you could try something like Wagyu steak with broccoli and Brazil nut pesto, or maybe duck pate with poached eggs and mushrooms. Chromium supplements, in the range of 200 to 500 micrograms a day, can also help out. Look for chromium picolinate or polyneucotinate, since they're absorbed better. And just a heads up, you'll want to avoid refined carbs, too much dairy, processed foods, and alcohol. All of those can drain chromium and make insulin resistance worse. So here's the big takeaway. While carbs and medications are important in managing diabetes, minerals like magnesium, zinc, and chromium are just as essential. They don't just improve insulin sensitivity, they also protect your nerves, support your heart, and help prevent complications down the road. By eating the right foods, choosing high-quality supplements if you need them, and steering clear of habits that deplete these minerals, you can really take a big step toward better blood sugar control and, honestly, your overall health.